Good evening. It's a 6:30 presentation once again. My name is Dr. Mike Sefton, and I am the Director of Neuropsychology here at Whittier, and do a lot with the brain injury programs that we have, both inpatient and outpatient. And so I'm happy to have been invited by Joanne Swiderski and Dr. Trichetta for this presentation, and I am grateful for the opportunity to be able to meet with people in the community, maybe some people experiencing the effects of traumatic brain injury or concussion, maybe those who have had a family member with a traumatic brain injury or concussion. It is just so many people that are experiencing this that we're happy to be able to provide it. Again, I'm also a certified brain injury specialist, and we teach that class through the Brain Injury Association of America, but about once a year, and it really is a great. If you're interested in that, you can contact me. But it's a great training process. It's a weekend. You get a certificate. It's a nationally recognized certificate. It's very intense, and it's an exam afterwards. So. Give it some thought if you're interested and you're doing this kind of work. It would be interesting. We try to do it yearly so that people who leave, we can fill them onto the BI team and get people who are educated and them to participate in our programs as staff members. So today we're going to talk about concussion, post-concussion, and the update, what kinds of things you'll know or need to know on post-concussion and its sequelae. So, by the way, March is Brain Injury Awareness Month, and so we're very fortunate this month to have two presentations, both on the notion of concussion. Dr. Bersani is presenting tomorrow night at 6:30. And he's going to be talking about sports-related concussion, and I will kind of cross talk on that. I'm going to talk a little bit about some of our population here at Whittier who are here because of concussion and traumatic brain injury. Dr. Bersani might focus more for parents and nurses and teachers and folks that are working with student athletes. That'll be more of the focus that he looks at. So, and that'll be awesome. He's a good speaker. He really is well organized, and he is very good at engaging people. I've always loved watching Dr. Bersani present. So, well, welcome everybody. I have nothing to declare in terms of remuneration from other companies. This is definitely a Whittier program. We've done it before, and each year we kind of tweak it a little bit, and hopefully it's a little more interesting. So Chris will present tomorrow on concussion, reasonable approaches to diagnosis and treatment. Now, it may seem like this is the cart before the horse. Well, not necessarily. So we're going to talk about some of the sort of macro incidence of and prevalence of concussion, and some of the areas that prevention needs to be taking place. And Chris tomorrow will speak about making diagnosis and what kinds of treatment plans or treatment goals he might think of. And we have done here today some brainstorming, and I hope that it'll be interesting for you. I certainly think it will be. So definition, we always start with that. I'm not sure why, but a concussion is any violent blow, jarring, shaking, other non-penetrating injuries. Once something penetrates, a knife or an arrow or a hammer into the skull, it's much different, and it's an open head wound rather than a closed head wound. Now, we have a couple of concussion patients here now who had a mild traumatic brain injury, but they look, because they had skull fracture with raccoon eyes, bruising behind the ears, a lot of significant ecchymosis in the face, we know they had a concussion and we know they had a skull fracture. Those folks can have a very slow, protracted course of recovery. So then concussion is any force applied to the skull. The skull doesn't have to hit anything too much. We've had people in seatbelts who have gone forward and became concussed as a result. The head moves forward. Eventually it stops as the neck kind of extends and the brain keeps moving inside the skull, and the skull on the inside, the anterior of the bone above the orbits, is very irregular. It's like the dashboard of a car. So the bone and the skull come together and they meet, and it's always the bone that wins. Skull is left with some microscopic, often hemorrhages, or some significant tears, depending on the inertia of the brain and how it might turn in the skull as the force is applied to the body and the head. So we really want to take a look at that, make sure that folks do not have any more serious bleeding. And we've had people that have had knockdowns. They get themselves up, dust themselves off, and within an hour may have had a collection of blood fill their head, and they've had to be a true emergency and sent to the trauma center. Also had people more recently hitting trees and being killed by skiing accidents due to head trauma this week. So, and then of course, Mitch McConnell sustained a concussion last week or the week before, and has largely been hospitalized since. He had a fall, bumped his head, was not unconscious, was talking and actually got up and walked over to a table and sat down. Was otherwise well, but he had headaches and rib pain, and so they hospitalized him in DC, and he had been hospitalized for 2 or 3 days and then transferred to an acute rehabilitation center. And so they're doing for him what we do here for our patients, just getting him his balance, his cognition, his physical functioning to be as independent as possible. So we always talk about sort of the way they regarded concussion in the last generation as getting your bell rung or having a little ding. And this doesn't look like a little ding to me. This picture it's ancient, but I keep it because it's Boston sports and I like it. You can see Johnny Damon there. He was center fielder, and this was the shortstop. And for the life of me, I can't remember his name. I can't read the name on the back of the jersey, but they collided at a high rate of speed, and you can see the photographer captured their heads coming together. I think Johnny Damon got the worst of that than the shortstop, but it looks like the shortstop caught the ball though. So we think about concussion as as we work with both young people, athletes, and olders. We think about, is it a true emergency? Okay, so we can't always say maybe this was a true emergency if one of them was not unconscious. I think that the athletic teams have really high quality physician coverage, so they're apt to have had these two guys looked at in the dugout, or even had a CT scan in the building, and or now the blood test that's come out that allows them within 15 minutes on the iStat to look at some look for enzymes or the product of the cell after it's injured, and they can quickly determine yay or nay whether the person has sustained a concussion or not, to the degree that the brain will release those chemicals and molecules that are then picked up in the blood. So that's a very good thing, and that's one of the updates for this year, is that there now is a blood test. Now the question is, one, is it very expensive? And two, and I'm going to call and find out, two, is it available everywhere? Because we have the iStat lab system here in our hospital, and we could potentially just do these tests if someone were to fall and become injured, bumping their head. So that's the newest thing. Signs and symptoms, again, we go over this a lot, and you probably have seen this. This comes right from the head injury literature, and also it's pirated by them from the CDC. If you're interested and want to have a bountiful of reports of diagnostic checklists, if you want to have the Aaron Bigler papers from the beginning in 2008, go to the CDC website. They've got a whole. It's all free. You can easily access it, and it's very interesting. So here's some of the symptoms. We can look at these. I guess this is somewhat interesting. There are physical symptoms. There's also cognitive symptoms, and there's psychological symptoms. And so we can tease those out here. Certainly unequal pupil size is a physical symptom. That vacant stare, any of you have seen that, it's pretty stunning to see a child who's 1 minute animated and chatting and sitting with you on the bench, and the next minute he's been flipped over head over heels, and you dragged him off the ice, and he's just staring off into the distance. Tinnitus, or ringing in the ears. Hyperacusis too is the ears recruit the sound, and the environmental noise becomes very painful for some patients. And these are not just kids or athletes. This is for both for concussion in general, broadly, and some of them are more common among athletes. And I think Chris will get into that tomorrow. Nausea, vomiting. I typically don't see that, and I always ask any vomiting, and they rarely have that problem. But I feel like the physicians, when they release them from hospital, they say, okay, if he starts to have nausea and vomiting, bring him back. Very delayed motor and verbal responses. There is a roboticness of patients who have concussion, acute concussion, and they are very robotic and slow, and they may ask the same question in a very kind of slow, monotonous, aprosodic way, and that's diagnostic. That's the decreased speed of processing, and then a delayed verbal response. You may ask a question or a follow-up to the question that they asked, and they look like they're deeply in thought, and they might say, then, would you mind asking that again? Confusion, inability to focus, memory deficits are key, or often frequent complaints. They ask the same question over and over. I had one boy on my bench that kept asking where his mom was. Where's my mom? Where's my mom? Every few seconds. So we called his mom. Emotions that are out of proportion to the disability, or the out of proportion to the injury. And sometimes you'll see kids that are just sobbing at having been concussed, and whether they're knocked out or not, they get back on the bench and they're just over the top emotional and confused and unhappy, and many of them want to go back out and play. So yeah, that's it. In football, they'll take the helmets, and the kid won't have a helmet, so he can't go running out on the field. Whereas in hockey, because we keep them on the bench, they've got to wear their helmets on the bench. So we have to kind of put an adult with the boy or girl that's concussed, and until the game is over. And if they choose to sit on the bench, they have to keep their helmets on. Okay, so you're going to see some errors of speech, errors of articulation, slurred speech, or incoherent speech. Our speech pathologists might call it language of confusion, or word salad. Sometimes that's apparent in the concussed patient, acute concussion patient. Incoordination. Oftentimes they have some middle ear vestibular kinds of reactions where they can't stand, and we'll give them the balance, the balance test, and they'll be really way off on their balance, or they'll complain of dizziness, they'll complain of lightheadedness. And so that's a physical finding that is important to recall. And there are treatments for that. And when folks come to our outpatient, they're very often getting OT for vestibular kinds of deficits. And we can talk more about that if anyone is interested. Disorientation, most of the kids are disoriented anyway, all the time. So they may say, yeah, it's Saturday, we have our game, and we have another game later on, but I don't know the date or the time. So we don't necessarily put a lot of credence into that, but it is important. We, generally speaking, we want people to be oriented and alert to things. Any period of loss of consciousness. So yes, that's a true positive, but the absence of loss of consciousness, and I say this because this may be contraindicated or counterintuitive to what you're thinking. The absence of loss of consciousness does not rule out a concussion. So a person can be very badly concussed and not have been knocked unconscious. So that's and that's not new. I'm sure you're all aware it's not new, but we have to emphasize that. We drive that point home because a lot of the parents who may not know that, as practitioners, as people here tonight, you probably do know that you don't need to be rendered unconscious to be diagnosed with a concussion, and generally speaking, perhaps 70% of them are not manifest with loss of consciousness. So we have a man now who fell flat on his face, didn't get his arms out, very hard, 200 pounds, hitting the pavement with his left anterior head and face, very badly bruised, concussed, and knocked unconscious. One would think, if he falls that hard forward and lands on his face, nose, and head, that he would have a loss of consciousness, but he didn't, and he actually is doing pretty well. So that's good to know. I'm happy for this man because he's eager to get out of here. Headaches, irritability, I feel like those things are always there. Morning headaches, tension headaches. If someone has had pre-existing migraines, they're apt to have pre-existing, post-existing migraines as well. It's not going to generally make the migraines go away, and if anything, they tend to make them worse. Migraines are very stress related, and so when someone is under a high degree of stress, like recovering from a concussion, wanting to get back into school, wanting to get back into work, feeling they can't be out of work or school, that's a lot of stress, and that stress and pressure can cause them to have more migraines. And there is definitely a neurobiology of both migraines and concussion and the sequela from concussion and post-concussion disorder. Sleep disturbance, in my experience with younger folks, there's an excessive need for sleep. They tend to sleep all the time, or they want to. And in the last generation of could you try again? In the last generation of rules and regulations for treating concussions, it was let them sleep as much as they want. And now we are strongly against that we want to get them up, we want to have them doing a little bit of light exercise. If the symptoms have abated within 3 or 4 or 5 or 6 days, and they can start getting a little bit of exercise. If it's an older adult, he can start walking a bit. If he's gone home from this event, recover with some rest, and then slowly reintegrate into a more motor routine. Whatever your routine was, you can slowly go to 25% of your routine, 50% of your routine, 75% of the routine. And then if you get symptomatic when you're walking, you expand your distance, you get symptomatic, you got to go back and wait a day or two and start over. So sleep disturbances, yes, and then depression may develop. It may develop in the course of this, and here's why. Especially among student athletes, and social student athletes, and high school kids are very social. Middle school kids are very, very social, and you take them out of that social, interpersonal, competitive environment, and they feel lost. They feel invisible. They feel like they've been forgotten. They feel often embarrassed that they have no outward signs of a condition, but they have a concussion. And at times they get angry because we keep telling them, you can't play, you've got a concussion. You can't skate, you can't go to practice, you've got a concussion. And this goes for football, it goes for baseball, girls softball. Last summer, we had an awful lot of girls with softball heads colliding, sliding into second base or getting hit with a ball off the bat. And that's big. So, okay, anything like that, you want to expect some changes in emotions. More typically, when teenagers come in, I had a girl a couple of months ago who was just as mad as a hornet. She was so difficult to work with. One of these elite basketball players. She's a very, smart young lady. She knows what she wants and she knows exactly how she's going to get there. And boom, she gets a concussion and strongly denies the concussion, tells her mom she's fine. And yet then she's got some of these symptoms. At the end of the day, she's got a vacant stare because she's so tired and trying to force herself to do so much. It takes a long time for cases like that to be taken care of. So that's the signs and symptoms. We'll kind of talk about those again a little bit. The prevalence, it says a 500,000 incidents of sports-related TBIs annually. Some believe there's even more, and I agree. There's as many as 3 million. I don't know how they capture that, but it's it is. So that's a lot of injured kids and injured adults. We're going to talk about people who fall in a minute. So if there's up to 3 million sports and recreation related concussions, what happens to all these kids? Well, as many as half of them don't even get seen. They go undetected. It's why they've, in the NHL and NFL, they put people up in the box to watch for concussions. And so when the guy in the sky sees somebody kind of acting a little bit different, shaking his head, getting the cobwebs out, or maybe walking backwards or walking the wrong way or falling down, up and falling down again, they know that something's up and they stop the play and they bring that person to the sideline. So we don't have that in youth sports. And so some of these go undetected. And many of the pro sports concussions go undetected too. They do ask that your fellow athletes, your teammates, drop a dime if they see you get hurt, and let the coaches know and the trainers know that you need to be looked at. So, and that's good because very often footballers would quickly go into a huddle, and one boy doesn't know what he's doing. He doesn't know the play. He's confused. He doesn't know which direction they're going. And so the rest of them would carry him along. Now they have to call the coach. They're duty bound to report that the kid has had an injury. So 2 in 10, that's 20% of high school athletes who play a contact sport. Now, softball is not really a contact sport, and it's a very high, in my experience with girls softball, it's a very high. I get probably 3 or 4 a year now. The concussion clinics, say at Emerson Hospital rather, may see 5 times that many. Everybody wants to go to the Emerson program. Boston University, Children's Hospital, many parents wanted to bring their kids just to Children's, but the wait is so long, so the numbers are very high, and the wait is so long. And what I say to people is, I would get them, if they came here, I would get them in within 24 hours. That's the key. You want to measure where they are on this continuum of concussion related issues, and begin the process of figuring out how badly they were hurt, how long they had confusion, how long the symptoms lasted, and then where do they go from here? Do they have those vestibular balance slight related symptoms that are very prominent? And we go from there and develop a program for them. So it used to be that wrestling was very high. They don't list that now unless it's behind that. But lacrosse, ice hockey, certainly football, girls field hockey, and soccer, very high incidence of concussions. I had my training at the University of Pittsburgh Medical Center. That's their concussion program is really renowned. We learned how to administer the impact preseason concussion protocol, and it was a computer-based instrument that we got a baseline set of scores from somebody when they were at their best or not being treated for concussion. And then when they came back in, we saw them and gave them a different version of the same test, and we could see how far off they were with their memory, reaction time, that slowing that I talked about, the roboticness. They just can't do these tests when they're still concussed. So the UMPC is really, if you look at them up, they've got the greatest sports medicine in the world. It's the clinic is right at the stadium where the Steelers play. When I was there, we would see kids coming in and adults coming in and pros coming in, and they would be doing their impact test. They'd go to the next room, and that's where the doctor would see them, and we would go over the test with the athlete and say, listen, hey, you're doing better. Your scores on memory and the different types of memory tests they give, much better. Your reaction times are much better. You're not missing as many items as you were missing before. And that's great. You're good to start working out. Or we would say, listen, this is the third week you've been in here and the scores are still just randomly low. We really think you need to start thinking about not going back. So if a season is 12 weeks and they're 4 weeks or 5 weeks into the season, maybe it's better you just sit this one out and you can start again next year or next season. So UMPC, look them up. If you have somebody you want to bring down there, Mike Connor is the psychologist down there that I worked with. Mickey, and it was Mickey Collins, and a good guy. And I would call him with a question. He could be having dinner, and he would answer my call and render some opinion on what I was working with. So a very good program and a very devoted medical staff. So we know that collegiate athletes, and I'll just say a little about this. Collegiate athletes tend to have more serious rates, less rate of concussion, but they tend to be more serious and they tend to last a little bit longer. And when I was doing, a full-time concussion clinic, I took care of some of the colleges and high schools around here, and I took care of the Worcester Sharks and the Worcester Ice Cats when they were in town, the hockey teams, and so some of the colleges we really had trouble with athletes at UMass Boston trying to get back to play, and they just were not resting. I think they were not getting that start, the brain healing. They were doing too much and the brain wasn't allowing to rest. And that's important. And so they have a high incidence of depression that goes along with that because they're psychosocially so tied in with their sport. Often they're at this elite level and they're playing other schools. Sometimes they play other friendships that they've met over the course of their careers, and it really bothers them that they can't be playing. So what about that? Concussion among elderly. You don't really, or I never felt until the last 10 years that there was such a correlation. But I would say that if we were to take a sampling of our population here now, that probably half our patients in our hospital are here because of falls. Now, that doesn't mean they all have concussions, but many do. And when I first got involved with this, we were missing all the concussions, not here, but out in California. And I said, why aren't we picking up these mild traumatic brain injury, MTBI? That's what we called them back then. We're missing them. Well, very often they're coded, diagnostically coded, fractured hip, fractured shoulder, whatever, fractured femur, and so the injury got coded, and the brain. Now, this is a long time ago, and that they no longer avoid talking about the brain. But the orthopedic surgery, because these patients were often in pain, very emotional, they wanted to go do that very quickly. And so we do know that they now take a look at the whole person. The trauma centers are designed to go from head to toe and to really make certain that there's nothing missed in the trauma exam. But it's extremely common now. The life prevalence of concussion is among about 40% of adults. Now, if you're over 55 or 60, you better start watching your steps and walking where you go. If you're over 65, they say you're more at risk. 1 in 200 of you might then fall and become injured. And if you're over 75, that jumps up to 1 in 50. So that's quite a high incidence of TBI, concussion-related problems and ED visits to hospitals around the area. So there are 3 age groups, and you can probably figure these out, that have the highest incidence. I'll give you the first one, 0 to 4. And somebody can, if they would love to put that into a chat box, what is triggering that when you think about concussion and 4-year-olds, 3-year-olds, 2-year-olds. The next group is the 14 to 17-year-old. And I would wonder or ask, what is it among 14 to 17-year-olds that's causing their concussion, their injuries? And then the next group would be the 65 to 85-year-old, the elderly people. So, okay, so those are the 3 highest incidents. I will give you the answer. All kids are learning to walk. They're walking more and more. They are using tricycles and other kinds of devices. And there's a very high incidence of head injury, brain injury due to physical abuse. And it's sad to say, but among 0 to 4-year-olds, it's high. So that's one component of the concussion and abuse and falls, and riding bikes without helmets, and riding a little more bike than they should have. Those electric vehicles, everybody wants to give their son an electric Jeep or an electric ambulance or something like that. You can buy them for $300, press the button, the car goes. Those have become at risk. Students, little kids go out in the street and turn around. The battery dies when they turn around, and they are stuck there, and they have to leap out of the car, and all kinds of traffic and whatnot. So not a good system for little boys or girls. And then as they get a little bit older, the driving, kids get their learner's permits at 15 and a half or 16. Some states it's even earlier. In some states in the Midwest it's 15, and here in Massachusetts it's 16. But that's a lot of responsibility, and so kids can have accidents early on. They're very at high risk of having accidents early on. And the brain, and not only concussion, but more severe traumatic brain injury is quite common. So we want to just kind of differentiate for you. And if anyone has had your own concussion, I put this slide in here last night because it's sort of a challenge. Think about when you, or how you remember your own concussion or your own injuries when you were a player or an athlete or whatever. We had a college professor a couple of years ago that was here with a concussion. She bumped her head on the kid's bunk bed, got a concussion, not bad. But then she was at one of the college's basketball games, and during the shoot around, those basketballs, if they missed, they'd come straight out into the crowd. You know, they bounce, and she got hit in the head with a basketball, and that sort of took her to her knees. She had ringing in the ears. She had hyperacusis, that loudness in the environment. She was very depressed. She had to take a sabbatical. It was her sabbatical, and she sort of lost out on that creative sabbatical that they had given her. So it didn't help because she was 3 months with symptoms. Anyway, so something like that can happen anywhere. So, and I remember playing college hockey and getting concussed, and it was horrible. I just could not wait till it was over. And I think it was 2 weeks. It was we had just come back from Christmas, I think, and we were playing here in Massachusetts, and I got drilled into the wall. And after that, it's nothing until we're on the bus, halfway back to Maine. So it can be really debilitating. I felt like a truck had hit me, and quite uncomfortable for the next week or so. But the athletic trainers, they work with you, and they are very well trained athletic trainers, and that's why it's sort of taken it out of our hands. The concussion clinics are maybe doing less because they all have athletic trainers on their squads of college teams and professional teams. The athletic trainers are very well trained and can do a lot of this themselves. But think about when you had your own concussion. The new millennials now who have kids, and their children are probably 9, are going to be facing the same questions. What do you do when your child has a concussion? And they might say to you, if it's a concussion. Very, very, because a lot of parents psychologically get so much joy from watching their kids play and compete, and then they become somewhat deluded that their child is going to get a Division I scholarship or more. He's going to be playing for the Bruins or the Patriots or the Red Sox. And so in that delusion comes oftentimes bad decisions, and the parents are often allowed to make that decision of when the child is ready or when the athlete is ready to go back to play and go back to school. So, and I'm trying to be somewhat, absurd about this, because no parent would want to put their child at risk. But they do push back very hard when I'm telling them and describing for them what the return to play program is. They push back still, even with having a lot of kids injured and a lot of kids disabled by these concussions. They still push back. Here's an older slide, but this ties it all in together. Symptoms of post-concussive syndrome. Now we've gone from the concussion that lasts between 2 and 3 weeks. There was a time when I was telling people 5 to 7 days, and then you can return to play. Now we don't even go there anymore. It's not sustainable that an athlete after 5 to 7 days goes from 0 play to 100% play. And I've had college athletes really push me on that. I've had the Sharks player push me on that, and they really want their friends to see them play. They want their families to come in and see them play, and it's tough. It really is tough when you have to say no to somebody. Anyway, so we use some of these slides to show them. We've got them printed out. There's a whole host of things: physical, sleep, mood, and cognitive. We talked about that. The cognitive stuff tends to return to normal, but when the other three don't, you can see some very different kinds of behaviors, and at times difficult to manage kids. And this is true for the elderly as well. The fatigue is probably the most common complaint when people who are older come into our hospital, and they can't think as fast as they normally would, and so that keeps them in a confused state. They feel lousy, they don't sleep well, they don't have an appetite, and they have chronic or acute pain from whatever happened. So they go a little slower, and the person that's fallen twice may recover a little slower still. The person that's fallen 3 times may recover a little slower still. And so what we're seeing is that whenever there's some concussion, there are some pathways in the brain that are destroyed, some cells in the brain that are not going to come back. So there's an adjustment, and the brain has to compensate for those deficits from that injury, and that takes time. Okay, so that's oftentimes a tough thing to express and to explain to a person that's older. Okay, so a brain injury can happen in a matter of seconds. And the most important things to remember are that the brain injury is unpredictable and its consequences are not always clear. And the brain injury affects how we think, how we act, and how we feel. Remember, how we think is our cognition, how we act is our emotion, our behavior, and how we feel is our psychology and our sense of ourselves. Most brain injuries are resolved in 2 or 3 weeks, but returning to play or returning to school or returning to work may be intermittent, may not be direct in 100% of time. It may be more divided out, where they go for a half day to work and then have a half day off. The next day they go in at the afternoon and take the morning off, and then so forth until they're ready to do a full day and a full week. But most injuries quiet down, that vestibular changes, the dizziness, the confusion, the vestibular kind of pumping in their head. They sometimes feel like their head is throbbing, the pain they feel, confusion, anxiety, irritability, but generally gets better in 3 weeks. And we tell them that, and they don't want to hear it. Many of our patients come in here for 2 weeks or 3 weeks after they've been treated at the trauma center, and so they'll come here and they'll get the message. We'll kind of work with them. We'll work with the family, with the emphasis that no more falls. No more falls. And we have one man that's fallen 6 times, and you hit your head on the sidewalk or the stone curbing, which we had a person, and it's very, very serious injuries. So a person with a brain injury is a person first. They're not a brain injured person. They are a person with a brain injury. And there's no 2 brain injuries that are alike. There's no 2 brains that are alike. And the effects on the body, this biopsychosocial aspect of a person's functioning, can be derailed and developmentally altered on the basis of a complex concussion. and they vary from person to person. If you've had a concussion, you're much more at risk of having another concussion. And so effects on the brain injury depend on the space in the brain that was damaged. So we have our left-handed gentleman here who fell on his left frontal head, and has subdural bleeding in the left anterior part of his frontal lobe and temporal region. And 4 years ago, had the right side that had been the same thing, subdural hematoma. Now, when you have bleeding in the brain, and most of the concussions do not, when you have bleeding in the brain, it becomes a real emergency, because we don't want, even a small bleed can fill in the space that exists within the skull and cause some midline shift. There's not a lot of room in the skull, and if the blood fills up on the front, it pushes to the back or pushes down in the brainstem, and it's not compatible with life. So we have to be very, very careful with that. So the duration of PCS. Now listen, this is an important set of slides, and this is not just for Children's Hospital, but it's consistent with the adult models as well. The duration of post-concussive syndrome. Not well described, but I would have to, I think it is well described now. It used to be described as a syndrome that would go away as soon as I blew it. It would go away as soon as the lawsuits were all settled, and very disrespectful. That was the medical understanding of mild traumatic brain injury back in 1980. That has changed, and I'm quite sure that that's not the belief that physicians have now when people have prolonged symptoms. 10 to 43% of people, kids included, have a duration of symptoms over 1 month, and others have symptoms even longer. And so we have people in our catchment that come in with 6 months worth of post-concussive symptoms. And we have to take them and look at them and help integrate them into their sense of self, a new normal, perhaps, a new baseline, perhaps. But they cannot simply wait until these symptoms go away. We need to work. We need to get balance better managed. We need to get pain better managed. We need to get their concentration and sleep enhanced. So there's a lot of things that come up. So when we have these patients come into our outpatient, now this is more of an acute setting at Children's Hospital, the initial presentation is largely physical. They hit their heads. Everybody wants to make sure that there's no bleeding in the brain or diffuse axonal injury. If the brain gets tweaked around from a ski accident, or falling out of the golf cart, whatever it is, you can have loss of consciousness associated with diffuse axonal injury. And that's when the axons that go from the left side of the brain to the right side of the brain get stretched and or demyelinate. They have a what's called retraction balls, and the wiring, the sheath itself is retracted, and the nerve no longer works as efficiently, passing its chemical message from one dendrite to the next. So in that case, you're running into a slowing of processing, a difficulty in focusing or attention, and a lack of new learning. But in general, the initial presentation is headaches, fatigue, dizziness, and taking longer to think. So those are the more common post-concussive syndrome. This is after 30 days. Secondary symptoms are common. They're sleep disturbance, irritability, fatigue, and forgetfulness. So again, memory, emotional dysregulation, poorly regulated emotions, and poor sleep quality. And I think the sleep and the irritability go together. And I think there's a confound that many of us do not overlook, but many folks do, is if you're the type that goes to sleep with the TV on, or if you have your iPad in your lap while you're trying to get to sleep, all of that light, that blue light, and particularly, can contribute to an active brain. We want folks to be much less involved with computers and screen time in those first 2 or 3 weeks, and then gradually increase the time as your body feels normal again. So it's very important, and often that is a confounding variable of why people are continuing to have symptoms in long time afterwards. So here's a picture of Anna Maria playing Roger Williams, and here's one boy that I know in the picture, the Roger Williams kid. Concussions can trigger chemical chain reactions. Now this is the reaction that we're trying to get and capture in the blood test. Okay, so there are some enzymes and molecules that are released from the cells when they're either damaged or tweaked by a concussion, and so they can leave neurons not working, or the penumbra around those neurons temporarily insufficient. It leaves the athlete feeling confused, slow, disoriented, and sometimes they can become unconscious and even succumb to those injuries. Fortunately, there have not been many, but they can impair learning for years to come if a person gets what is either second impact or a more serious traumatic brain injury that requires hospital care. So this, again, we could have alluded to this. What happens in the brain is the brain moves around in the cerebral spinal fluid that it's bathing in. The axons from one part of the body to the next often are stretched or damaged, and they don't carry the impulses as frequently, or they're not as efficient at sending their neuronal message from one neurocell body to the next. And so that loss of connectivity of different parts of the brain is what causes us to be inattentive, confused, forgetful, having head pain, and on and on and on, all the symptoms that we showed you early on. So the neurons that are firing simultaneously can cause some what they call paroxysmal discharge and autonomic storming. The body is just activated like an extreme stress response. And this, I see a lot of outpatients who come in and they are just as wired as tight as you can be, and they don't take any time to relax. Many of them are working out on their own, even though they're not supposed to be. Many of them are on the computer watching their college team on TV. Now they're all on their own streaming services, and on and on and on. Autonomic storming is something very scary to see, and that's generally something more common to the severe traumatic, moderate to severe traumatic brain injury. And it causes, when the cells are firing really without any call for that, and they are discharging, and if they discharge too much, they can die. The cell loses potassium, calcium rushes in, and then the mitochondria will not transfer from one cell body to the next, and it can be very, very tough. So it's these chemicals that they're looking for in the bloodstream that generally speaking are found only in the cell body, in the nucleus of the cell, and those enzymes and proteins that are supposed to be in the nucleus are now in the bloodstream. Now it's a tiny little number, but they can say, aha, this is definitely a like somebody's microphone is on. Check your system. That said feedback. Okay. Oh, it's a good question. There's a couple of questions. I didn't see them come in. It doesn't pop up. Why are patients that have had a concussion at risk for another concussion? And are those yeah, the falls, I'll take first. The falls, once a person has fallen, it really does take a lot to keep them from falling again. And the risk then is because they tend to not recover to 100%. And again, depending on age, depending on how active the person was, depending on how much family support they have, many times they don't, they're at risk of falls, getting falls. As for the athlete with concussion, I just feel like these are kids that are on the bubble. They are, those 1%ers that are elite athletes, and they play volleyball year round. They play basketball year round with traveling teams, soccer teams that travel, and they're just a high intensity athlete, and they just, because they go faster than they push themselves to that limit, they're more at risk of getting falling again or getting into an accident of some kind and developing another concussion. So I wanted to I am more than my brain injury. It's supposed to come at the end. This is really, we want to think about people and bring them to life. These are two kids that I work with from Rhode Island. I took care of the Portsmouth Unified School District, which is near Bristol, Rhode Island. These two kids, I think one of them lived in Bristol, but they went to the same high school. The parents have given me permission. I've used this for a number of years. This was back in 2009. The boy on the left is Dylan Mello. He was scheduled to play Division II soccer at Assumption College. Couldn't go because he got a concussion in his junior year and just had to sit out his whole senior year. And then they were thinking about how to get him back in the queue to play for the college and whether he was still at that level that he could do that. His buddy there, Dylan Mello, had also a concussion, and I happen to have a video of his injury. Neither one of these boys was very large, and I do think they both played hockey, but Dylan was the smaller of the two. The boy on the right, they don't look very thick in this picture, but both were sophomore or juniors, and so okay, so that's it. I didn't put it in. It's let me just see if I can find it here. I hope you can see this. Hola. Okay. It's doing so what I wanted to show is this boy's hit. He's a small kid. He is fast as lightning, but he was playing against boys that were much older. He was a varsity ice hockey playing. He was about 125 pounds. And if anyone knows the average player probably is 170 and there are, defensemen and goalies and so forth that are 200 pounds. So as a 17-year-old, the right-sided guy, Dylan, was knocked up over his head and onto his head and got a concussion, and he missed 3 months of school. The other boy had a similar experience, but I think he got a little bit slower. He wasn't quite as anxious to get back to the play as the other boy. So both were at risk if they went back too soon. The boy on the right had a severe, complex concussion. He tried to go back and failed, and we worried that he might have a second impact syndrome, which is a life-threatening reaction, rapid intracranial pressure with the second impact, with the second blow to the head. When I talked about the college professor who was concussed, it was a mild concussion, she was resting, and then just so happens she went to a basketball game and she wasn't playing, but a ball came out and hit her in the head. That's second impact. And her response was much greater to that than you would expect. And we have also other people that have had second impact. I'm not seeing them. I have a blog, and we try to put some of the people we feature on the blog, and it just isn't showing up. But we had the second impact syndrome, a host of people that had died as a result of it. A boxer from Ireland in 2017 or 2018, a young woman, a female MMA mixed martial artist, 18-year-old married woman, came from Mexico, went to Mexico City, came from like a village in Mexico to fight the big fight, was going to make herself a hero. She ended up getting a concussion early in the game, and then another blow to the head and died. A white guy, they got her to the hospital, but there was nothing they could do. It is a matter of seconds where the person, if they're not treated immediately, will not be able to survive the rapid intracranial pressure that occurs as a result of this abnormal response to another blow to the head. So it's something that doctors see and can't do anything about as yet, and it's very, very scary. Very, very scary to see and terribly sad to watch. So more and more, we're getting a little bit better at understanding that and keeping people safe. We will do this again. I feel like we need to finish up here. I'll share this with you. At what point do we have somebody stop playing? I assume you can see this blue slide. When somebody has had 3 concussions, I feel like that's enough. They're vulnerable. They played for 2 years in football. First year they got 2 concussions. The next year they sat out for half the season, went back in the fall, had a concussion, a 3rd concussion. That's a lot. And I remember when Patrice Bergeron, the Bruins player, I didn't get to see him, but I had been working with the trainer and had gotten to know the trainer of the Bruins who was caring for Bergeron. And they were really not sure he was going to be that guy that could kind of move through the concussion and get back 100% and not be at risk for over and over again. And now that was 18 or 17 years ago, and he has shown that the test of time as an excellent athlete and has not had recurring concussions. I will say that some of the teams that I've worked with, when someone is prone to concussion, they don't want to keep them. They lose a player if he's out for some undeterminate length of time. They trade, or they retire them. So there comes a time when a family has to decide when they will pull a child from, or an athlete from his sport, and that's very tough to do. And if you've got kids your own age, kids that are of athletic age, playing sports, or if you've yourself experienced a traumatic brain injury and are questioning whether you should go back to play again, 3 times in 2 years is too much, and each time it's longer to recover. So there is a confounding variable there that we can't put X to. Someone would say, well, boy, last time it was just 2 weeks and I was feeling great and I went back to 100% play. Well, this time it's not going to be that fast, and that's the way we have to deal with it. And it's often you have to counsel those people, because depression becomes very, very significant. All right, so I've gone over, and I want to look at whether there are any questions that people have. And depression is by no means the only emotional consequence. Anxiety, irritability is a very high incidence, and in spite of the good helmets that are now provided for football, the helmets are all multi-layers. The helmets themselves can shrink and can absorb energy that way. There's an internal bladder that is filled with like a solution that kind of absorbs some of the skull going back and forth. Certainly the racing car drivers now their heads are all guarded and helmeted and strapped in and braced. I think a big question going forward in our next update, we'll talk about the veterans and those who have experienced the trauma of war, as well as the trauma of brain injury, and they're getting back here, and they've been here in our society for 10 years now, and how we're treating them and how we're getting them back on their feet. I work with law enforcement too, and for those that have had concussion from a brain injury from on the job related stuff, sometimes it's insurrection type things like the January 6th, or sometimes it's just a fight with somebody that you get into as a police officer, and we've had to help and work with them. And some of those folks, we use biofeedback, and we use the vestibular retraining, and we use dentists if there's sort of TMJ